Hi, my name is Caitlin, and this is my reflection on the ATI Critical Thinking Entrance Assessment. I scored a 73, which shows that I have a good starting point, but still have room to improve for sure. I did well with recognizing cues and understanding the basic concepts and basic connections, but I found it harder to prioritize problems and evaluate outcomes when more than one answer seemed right. What surprised me most was the entire test. I spent a lot of my time focusing on the fundamentals and studying all of those rather than um, really harnessing in on the critical thinking aspect of it. So some questions made me really think through what was happening in the scenario and why. And this showed me that critical thinking is more about judgment and problem solving than recalling facts. Overall, the exam helped me see or how I currently approach the patient problem and the areas in which I need to grow in. Um, so to connect the critical thinking and clinical judgment to nursing practice, clinical thinking is used in every step of the nursing process and the ATI critical judgment model. When we recognize cues, we notice important data like changes in vital signs, lab values, or symptoms. In analyzing these cues, we figure out what those findings mean. Next, we prioritize hypothesis. We to decide which issues need attention first, like treating low oxygen before worrying about pain. Then we generate solutions and take action, which means planning and giving care based on what the patient needs most. Finally, we evaluate outcomes to see if the care helped or if something needs to be changed. For example, if a patient with pneumonia suddenly becomes short of breath, the nurse must quickly assess, recognize the cues, and act fast by giving oxygen. Good critical thinking helps keep the patient safe, while poor critical thinking could delay care and lead to more serious problems. Three, growth and development plan. To improve my critical thinking skills, I plan to practice applying what I learned instead of just memorizing and using flashcards. So really harnessing in on labs and throughout clinicals and things like that. Um, I'll use case studies and simulation labs to work through patient scenarios step by step. Asking myself questions like, why is this happening or what might happen next will help me connect the dots and think more like a nurse. I also plan to use concept maps to organize patient information and spot patterns that point to priorities. Talking through care plans with classmates and instructors and mentors will help me hear different viewpoints and strengthen my reasonings. I'll also use the ATI tool and the critical thinking judgment worksheet to practice structured decision making. My goal is to raise my ATI critical thinking score to at least a 90% by the end of the program. Meeting this goal will show that I have improved my abilities to think critically, make safe choices, and feel more confident in clinical settings. Four, um, overall, my final reflection. The biggest lesson I learned from this assessment is that critical thinking isn't just about knowing information. It's about using the knowledge to make safe, smart decisions for our patients. This exam reminded me how important it is to stay alert, notice small changes, and act quickly when something seems off. So just really, it really made me think through just the little things and like minor details and little things that you really might think don't matter, but in nursing, every little detail matters and every little detail could have some reasoning behind it as to what's going on with the patient or how we could help them more. So, um, yeah, I think that just being able to make those changes, improving my critical thinking skills will make me a stronger and more confident nurse. In real life, things don't always go as planned, so I need to be ready to assess, think, and adjust care as fast as possible. These skills can literally make a difference between a patient improving and a patient declining. I'm committed to working on this every day by reviewing missed questions, asking for feedback from instructors, and staying active in clinical reasoning practices. Strengthening my critical thinking now will help me not only pass future exams, but also become a safe, capable, and caring nurse for my patients. Thank you for listening to my reflection.